Welcome back. We're glad you returned. For our last portion of this program, we're going to go through a Q&A session that was part of the live program, as we discussed earlier, in Auburn in 2015. And I want to orient you to how we're going to do this because it might be a little different than what you're used to or accustomed to. In the live program, we asked the audience to submit questions on note cards that I then collected, and we used those during the Q&A, in which I asked each question or read each question from the note card, and the panelists answered those questions. So what we will do today is I will read the questions for you as they were presented during the live program, and then we will cut to, if you will, the video of the answers from the program in Auburn. So we'll go ahead and get started with the first question. The first question that was asked was, if you are licensed in Alabama but practice in another state, is it appropriate to register with Alabama's prescription drug monitoring program?
For pharmacists, you have to be licensed in Alabama. So if you are practicing in an adjoining state, you can register for Alabama and look at their look at our PDMP information. What we're trying to do is get it all in one login. So right now you would have to log into both your practicing state and Alabama state, which would be two different websites. So, but yes, you could certainly do that as long as you're licensed in Alabama.
The second question that was asked is, how up to date is the report from the PDMP? There are rumors that there is a 14-day delay between reporting and being available.
That was true when we were reporting weekly, and it wasn't really quite 14, it was more like 10. But now that you're reporting daily, it is pretty much within 24 hours everything should be in there. The only exception, and John can correct me, is if it's downloaded on Friday night, the data is not going to go in until Monday morning.
That's correct.
The next question, if the patient's phone number is submitted as the patient's insurance number, does this create problems in the database?
No, it wouldn't create a problem because we are not doing any check on their insurance ID.
Okay, but it would be bogus data. But
yeah, it would be in the database as bogus data.
Okay,
yeah.
All right.
I don't even think there's a field for insurance number.
An audience member also asked, if I practice in Georgia in a retail community setting and I have a report to file on a prescription written by an Alabama prescriber, do I report the incident to Alabama, since the prescription was written in Alabama, or do I report it to Georgia, since the prescription was filled in Georgia?
I don't know the answer to that, but I would guess that if the dispenser is registered with the PDMP in that state, that's the state within which they will report.
Just to add on to that, basically from a vendor's perspective, that's always been the rule. You report to the state that you're dispensing in. So.
Next question. Why do states not share PDMP data?
Really good question. To share data, there's two obstacles we have to overcome. One is legal. Anytime you get lawyers involved to come up with an agreement between two states, it's a long, drawn-out process. It can be done, but it takes a while. The other part is technology. I'm not going to go into a lot of detail because I don't think you all care, but there are two architectures out there on the PDMP data, and our law specifies which one we have to use. So if a state is using the other one, up to this point, we have not been able to share data with them. So we're trying to overcome that. The other architecture has kind of beefed up their system to make it more like ours. So in the near future, we are really hoping once we get this agreement in place and it's close, and the technology is taken care of so the systems can communicate, we'll be able to share with many, many states. There are upward of 20 states right now using that other system. The problem with, I'll go ahead and address this, the problem with Georgia and Florida, they have specific laws that prevent them from sharing data with us. So until their lawmakers, their governors, come up with some new legislation that allows them to share, it's just not going to happen.
We've had questions at the Board of Pharmacy of could we participate in that? Could the state participate in that? There's a product, and I guess one of them that you're talking about is the NABP Interconnect. There's a system that NABP put out, and NABP assures us that they're only a conduit in the process, that they're not going to stop the data, look at it, try to control things from their end. But there are also some provisions in our law, in Act 205, that we have submitted to our attorney, and we think we might have to have an opinion from the Attorney General before we can go forward with that. Maybe, maybe not. But it's like, well, the benefits truly going to outweigh it. So I think that, eventually this is going to happen, and hopefully when we say eventually, we're not talking about years, we're talking about a short period of time.
The audience also asked, in what situations has it been helpful to enter notes on a particular patient's query results?
If it was a follow-up prescription and they were already in the database, you could probably add that note of saying refuse this particular prescription.
That's a possibility.
The audience also said, thinking about those of us in Alabama having access to PDMP data from Kentucky and Maine, how has that been useful?
Those were the two states that we could quickly, and this occurred before I came to the department, but the technology and the legal stuff was in place, so we could quickly share data with them. You would be surprised how many Alabamians search for Maine data. We have a lot of snowbirds coming to South Alabama from Maine, and John probably has better data than I have on that.
Yeah, just to add, as Nancy said, you would be totally surprised if you looked in the PDMP system on a Kentucky or Maine search and you saw how many prescriptions there really were. So it doesn't look like it when you look up front and say, why would we connect with Maine? But it does make a justified case.
An audience member commented, I'm often asked by physicians to print out and fax them a report from the PDMP. Can you address this request that I have received?
I've seen multiple places in previous presentations where that is not recommended. You have some liability if that falls into the wrong hands or if it's not used in the proper method, and Nancy, you may want to follow up on that.
When you fax something over, you don't really know who's getting that, and that would be my caution on that. Certainly you can pick up the phone, call the prescriber, and talk to him about it. One example, a nurse practitioner called me one time and said, had this pharmacist to call, and he told me that I need to look up the patient on the PDMP, but he refused to give me the patient's name. So it did the nurse practitioner a little good. You can share that patient's name with another healthcare professional who's providing care to that patient without violating HIPAA. And so we do really recommend you doing any kind of consultation with the prescriber verbally and not printing the PDF or faxing it.
We also heard an audience member who was interested to know, can I print a PDMP report and give it to a physician who doesn't have access to the database?
They all have access.
Right.
And if they tell you they don't, then they could be fined several $100s. But yeah, they all have access. They may not know their password, but again, you can talk to them verbally about it, but not print it.
The next question, will the PDMP ever be real-time and perhaps provide alerts while filling a prescription?
Actually, there's only one state that's real-time. It's Oklahoma. And when you get into the dollars it took, their actual state gave the money. It was millions of dollars to make it real-time. And they're actually piggybacking off of their insurance claims, which means when someone fills a prescription and the insurance verification is going across, it dumps off the PDMP record. So that's their real-time version. 24 hours is about as quick as we're going to get. We have a couple states we've experimented with every 4 hours, but they're not seeing any major benefit versus the 24-hour. except a higher price tag, but that's still to be debated. So the whole thing about real time, a lot of people got caught up with, that'll be nice, but there's a lot of headache with doing real time prescriptions.
Next, is there a way to access dispensing records by pharmacy instead of by recipient of the prescription?
Not from a user login or portal, no. It's only by recipient.
If you submit the wrong DEA number for a prescriber, can it be reversed by resending the dispensing report?
Yes, yes. Not the dispensing pharmacy.
In refusing to fill a prescription, can we tell the patient that we pulled the information from the PDMP database and that information shows that they have numerous controlled substance prescriptions being filled?
Physicians do that. I've been to several medical association meetings where Dr. Harrison and other board members spoke, and the physician does talk to the patient about what they found on the PDMP. They don't give the patient a copy, which has been requested several times, but they do explain what they have found on that.
Continue with our questions. In this scenario, the pharmacist works at the VA. They have close communication with prescribers. They have electronic records system-wide, and they have privileges beyond that of other pharmacy settings. So what do I do if a prescriber asks me to document in the patient's medical record why they are not prescribing a particular medication based on information that I found in the PDMP and relayed to the prescriber?
The physicians are, what they are told to do, and again, I haven't attended many pharmacy meetings, but the physicians are told to document in there they can say, found information in PDMP, refused to fill prescription or refused to issue a prescription for this patient. You can reference the PDMP in your notes that you did that you searched it. You just can't put a copy of it in the chart, a copy of the report itself.
Another question. What is the likelihood that prescribers in other states will have access to our PDMP database?
We would have to set up that MOU and that the technology would have to be there. So, hopefully one day, but I don't see it anytime soon.
And another question. We've talked a lot about not printing and sharing PDMP data with others. What about the medication list we create and provide to hospitals when our patients are being admitted? So in this particular question, the question really isn't about PDMP data. It's about medication reconciliation list.
So I think what Nancy was talking about is that liability and the problems that can happen if you're printing things off and you're sending them. On the other hand, if you're dealing with like a transition of care where the patient's going from a community into the hospital or from the hospital back into the community and you're transmitting what is considered protected health information, as long as there's a business relationship between those individuals caring for that patient, that's not a problem.
And the law doesn't state that you can't print it, right? The law just says that there are penalties if the information is disclosed inappropriately. And another question. How do long-term care facilities handle reporting?
Well, in certain situations, and it varies, most of them you can tell it's long-term or a nursing home or whatever it may be because the address is going to be the same for those patients, and it's actually the facility address. And I don't think we ever make a big stink about the address. It's more of the medication, the patient, those items or fields that we're more concerned on versus the address. But I have seen those addresses repeat for multiple patients. So.
I want to remind you that this program was brought to you by the Alabama Department of Public Health, the Alabama Board of Pharmacy, the Alabama District Attorneys Association, the Alabama Board of Medical Examiners, Health Information Design, and the Harrison School of Pharmacy at Auburn University. For those of you who are seeking pharmacist CE credit, go to the link on the screen and then click on the link there for the Prescription Drug Monitoring Program. If you have questions regarding CE, you are welcome to email the address you can see on the screen here with your questions. Again, thank you for attending our program, and we encourage you to come back to the ADPH website for additional training.